Hi, my name is Brittany Heitmann. I'm here today for my video blog on informed consent. So I just want to get started by telling you a little bit about Delaware and the licensing protocol that comes with Delaware's licensures. So in Delaware, a master's degree has to be, for clinical mental health counseling, has to be at least 60 graduate semester hours. And that equals the equivalent of a clinical mental health counseling degree, such as we're getting at Liberty. The degree must encompass the 8 core areas that the ACA has recommended, which Liberty does. And there also has to be combined 3,200 hours of supervised counseling that has to go with that. So 1,600 from the program and then an additional 1,600. So you are required to have provided 1,600 hours of post-mental health. Yep, so I kind of went over that a little bit. And it has to be done within 2 years to 4 years, no less than 2, no more than 4, of completing your degree. So that is a little bit about the Delaware licensure. There's a board that you submit everything to, all of your test scores from the national counseling test that you must take, the examination. You submit your scores along with all the other documentation, a criminal background check, your social security card, all of your criteria that you had for school, all of the classes and the curriculum with your transcripts, your supervised hours, and then you can get certified. So the informed consent that we are learning about today, the recommendations from that come from the ACA. So the recommendations are: purposes and goals need to be included, techniques and procedures, limitations and potential risks and benefits, counselor qualifications, their credentials, their experiences, excuse me, what relevant experience that they have, basically, the implications of diagnosis, intended use of tests and reports, fees and billing arrangements, confidentiality and limitations, information on records, rights to participate in the ongoing counseling plans, and the right to refuse to be counseled if you don't want to be. So I found an informed consent from a practice called reflection therapy. The gentleman's name is Robert W. Montgomery. He is an MS LMFT. His description of practice is marriage and family counseling. He states his name. He's a therapist under the practice Reflection Therapy Services. He is licensed in Alabama, license number 426, and is a systems as a system therapist and solely responsible for your counseling. Should you have any questions on treatment, you address it directly with him, including general therapy services, therapeutic modalities, and offered including therapy for caregivers. So he's saying come to him with any issues. I also want to mention that I feel that this informed consent includes all of those ACA recommendations. Your right as a client, so he goes through the rights. You have the right to ask questions about any procedures used during therapy. Your therapist will explain to you the methods. You have a right to decline the use of certain techniques. You have the right to end therapy. You have the right to not receive therapy. You have the right to dismiss. The therapist has the right to dismiss you. You have the right to confidentiality within certain limits. You have the right to be treated by your therapist in a consistently competent and ethical, responsible manner. You have the right to discuss your treatment anytime with the therapist. If you have any concerns of this, you can speak to the office and talk about your privacy rights. So those are your rights. The general information regarding appointments. Appointments are scheduled for 50 minutes. Clients are typically seen weekly or bi-weekly, so he goes through and explains when they're seen. For a Monday appointment, you have to call by 5 p.m. For missed appointments, late fees can apply. Phone calls, you will receive a voicemail to confirm your appointment. In the event of a safety or life-threatening emergency, do not call 911. In the event of a safety or life-threatening emergency, do not call 911. Call the office. Call 911 to your local emergency room. So you do call 911, but you also give the office a heads up. Referrals. Your therapist does not hospitalize people, so they will refer you to an inpatient mental health facility. Confidentiality. Issues in therapy are private and considered legally protected, so he cannot speak to anyone. If you plan to harm yourself, there are exceptions to this. He will have to get you some help. Your therapist is obligated to take whatever actions to help you from harming yourself or others. If your therapist has reason to believe that a child, elderly, or handicapped individual is being harmed in any way, he has the right to report that. Fees and payments. So there's a $100 fee. There is therapy. For the therapy. Psychological evaluations. He goes through to explain how he'll do that. Termination. Once you've achieved your goals, and your therapist will collaborate in making a treatment plan so that you can finish. So he goes to explain the initial assessment and how he'll go over the informed consent with you. He goes over the benefits and risks. There's no guarantees, he states to this. And that he will be remedied by pursuing treatment. He's going to try his best, but there's no guarantee for any success. Efforts to make changes, he goes on to say. He can make changes in this if he needs to. And then he talks about minors. There's no secret policies with couples or families. So basically, if you come in together, anything is open. And it says here that you have to sign the consent for treatment. So I feel that this consent that I found from this gentleman, Robert W. Montgomery, he goes over all of those ACA requirements that we found in the beginning. In Ethics in Psychotherapy and Counseling, which is a practical guide, the 5th edition, it's written by Kenneth Pope and Melba Velasquez. They state that the right to informed consent reflects respect for individuals. It respects their freedom, autonomy, and dignity. It's fundamental to the ethics of therapy and counseling and the APA Code of Ethics Fourth Standards for Conformed Consent. So note that informed consent is really about respect. It's about respecting the client and their privacy. So this is Brittany Heitmann, Informed Consent. Thank you.